Welcome to the University of Missouri Ear, Nose, and Throat Clinic. We hope you enjoyed this brief presentation about sinus and nasal surgery. Sinusitis is a problem that affects 31 million Americans every year. Most cases of sinusitis are self-limiting and get better with simple medication and time. Chronic sinusitis is a condition in which sinus symptoms last greater than 12 weeks in duration. Common symptoms include nasal and postnasal drainage, facial pain and pressure, nasal obstruction and congestion, and decreased sense of smell. Other related symptoms include fever, cough, fatigue, dental pain, ear fullness and pressure, and headache. The sinuses are chambers located around the nose, eyes, and forehead region. From this view, you can see the frontal sinuses, located in the forehead region, the ethmoid sinuses, located between the eyes, and the maxillary sinuses, located beneath the eyes. Healthy sinuses are filled with air, which looks black on the CT scan. The maxillary sinus opening is well visualized and is not blocked. In patients with chronic sinusitis, often the sinuses are swollen with inflammation, polyps, or infection. This appears as gray areas on the CT scan. These swollen areas may also block the opening to the maxillary sinus as well. One additional sinus, the sphenoid sinus, is located in the back of the nose adjacent to the brain. The sphenoid sinus may also be affected in chronic situations. There are multiple factors that go into the cause of sinusitis: allergy, immunology, bacterial infection, fungal infection, polyps, and anatomic aberrations or blockage are all possibilities. Sinus surgery may be indicated in cases of chronic sinusitis with symptoms lasting greater than 12 weeks in duration and is unresponsive to medical therapy. Certain cases of recurrent acute sinusitis, that is, frequent bouts of sinusitis, may also be helped with surgery if the offending sinuses can be determined. Surgery is also required in cases where polyps, masses, or suspected tumors need to be removed or biopsied from the nasal cavity. The goal of sinus surgery is to relieve blockage of sinuses to establish better drainage. Medical treatment, especially for allergies, may still be required after surgery. Sinus surgery is typically performed in the operating room under general anesthesia. A lighted telescope is introduced into the nose for visualization. A specialized sinus surgical instrument is used to open blocked sinuses by removing offending and obstructing tissue. Depending upon individual patient circumstances, an alternate method may be used to open blocked sinuses. Balloon sinuplasty uses a small catheter to access the sinus opening. A balloon is then inflated to widen the opening with less trauma to surrounding tissues. In addition, your septum, or the wall that divides your nose in half, may also be crooked or deviated. A deviated nasal septum can cause breathing difficulties, snoring, as well as impede adequate visualization of the sinuses. If required, a septoplasty may need to be performed. A septoplasty involves making a small incision inside the nostril. The lining of the septum is carefully lifted off, allowing access to the deviated cartilage and bone. The deviated portions are then removed, and the lining is redraped. The structure of the nose is preserved by leaving good beams of support to the nose. If these beams themselves are crooked, your doctor may recommend other methods to help straighten the septum. During your visit with your physician, please review your medical history, including all medicines. Hold aspirin at least 2 weeks before surgery. Prior to surgery, an appointment may be scheduled with an anesthesiologist as well. The role of the anesthesiologist is to keep you comfortable and asleep during the procedure. The anesthesiologist will also want to review your health to make sure that you are a good candidate for surgery. Don't eat or drink anything after midnight the night before your surgery. If you're taking a medicine that has a morning dose, you should ask your doctor if he or she wants you to stop the medication the night before, or take the medicine with a small sip of water at an earlier time. Call your surgeon if you get sick shortly before surgery. Your doctor may want to put you on an antibiotic or, for your safety, your procedure may need to be postponed. As with any surgical procedure, there are risks associated with sinus and nasal surgery. Even though the risks are extremely small, you should be made aware of them. There are risks associated with anesthesia, rarely even as serious as death. The anesthesiologist will be able better to inform you about these risks. Minor bleeding and reddish drainage is expected from the nose for days following surgery. Afrin nasal spray can be used to help slow the bleeding. Please contact us if significant nasal bleeding occurs. The eye and the brain are in close vicinity to the sinuses. These areas are always potentially at risk, leading to more rare but serious complications such as vision problems and cerebral spinal fluid leakage. In the performance of a septoplasty, if the blood source to the lining of the nose is injured, a potential perforation or hole may occur in the septum. This may or may not be symptomatic depending upon the location of the perforation. As with any chronic sinus condition, revision surgery may be necessary. Factors such as scarring and polyp regrowth affect the need for future intervention. The length of the surgical procedure is variable depending upon the extent of the surgery. Most patients will be able to go home the same day. An overnight stay may be needed in certain circumstances. Drink plenty of fluids. It is very important that you stay well hydrated. Patients who get dehydrated tend to have more problems after surgery than those who stay on top of their fluid intake. You may advance your diet slowly once your appetite returns. The level of postoperative discomfort is variable from person to person. Nasal stuffiness and pressure steadily improves over the first week, especially after your first post-operative appointment. You may want to budget a week off from obligations for recovery. Take all the medications your doctor prescribes, which may include a pain medication as well as an antibiotic. Avoid products that contain aspirin because they interfere with blood clotting. There are some supplies you may want to purchase before surgery. After surgery, a mustache dressing may be taped beneath your nose. You can replace this dressing as needed after surgery with 2x2 gauze pads and half-inch paper tape. We generally avoid placement of true nasal packing unless substantial bleeding is encountered. Internal nasal dressings, however, may be present. If you had a septoplasty performed, silicone splints may be inside the nose, which will be removed 1 week after surgery. If you had sinus surgery performed, there may be some absorbable nasal dressings placed inside to prevent early scarring. Saline irrigation to the nose is important after surgery. You can make your own saline with a recipe that we will provide you with, or you can purchase ready-made saline from the pharmacy. This irrigation helps wash away blood and drainage. It facilitates cleaning the sinuses in the clinic after surgery, and it improves sinus functioning. Thank you for taking the time to learn about sinus and nasal surgery. Please ask us any questions you may have.